Good morning from Southern California. This is Dr. Tom Peters, and welcome to my next video on partner relationships for young adults to help them make better decisions about themselves and their relationships. This video is going to be a summary to the previous 10 videos I prepared together with the help of some of my friends, and I would like to clarify a few issues. I want you to watch these videos. If this is the first video you watch, I want you to watch the previous videos we did with focus on the issues that young adults have to deal with in their lives, because they don't know what's ahead of them. I tell you what they are used to. If somebody is 20 years old or 19 years old, that person is used to going to school, getting up in the morning, getting ready for school, getting instructions at school, and then at 17, 18, 19, starting their first employment and dating, but they still live with their parents. A lot of them live with their parents. Others moved out of the house, so they live with friends, or some of them started cohabitating, but all of these are first experiences to them in adult life. And you know, everybody's used to psychologists and dentists, doctors, revealing some information that the general public has to know about health conditions or mental health issues. This is not that type of video. None of these videos are belong to that category, because I was specifically asked to talk about these issues. Somebody wanted to hear me talk about these issues. That's all I can say. I never talk about anyone's identity. I never talk about anyone's involvement in what I do, because I always protect the privacy of all of those I'm involved with. You know, not just in the office, but even friends. So I cannot reveal more, other than I was specifically asked to talk about these issues, not just by one person. Okay? So all of these issues are relevant to them, but let me tell you a story, and the names were changed to protect the innocent, not that anyone's so innocent in the following story. A young woman came up to me the other day and said, "Hey, I'm Sheila." "Hi, Sheila. I'm Jacob's wife." "Oh, Jacob who?" "Jacob, Colorado." "Oh, Jacob got married. Congratulations." "Well, as a matter of fact, we were married last year when Jacob had that fling with that girl." "So is Jacob still in college?" You know, that was the conversation that really happened. And when you are in psychology, you never confirm anything to anybody who asks you about a client. As a private person, I have the right not to get involved in such messy situations and not to give any information to anybody about anything that I know. You know, first of all, in that situation, I don't know why I was approached by this woman. I never met her before. How do I know that this woman is truly married to that Jacob? And how do I know that she is looking for confirmation about a relationship that I might have known something about or not? But this is the issue of somebody who is a young adult. Everybody in this story is a young adult. However, this story would be very different if we considered the same thing, and one of them is 36, the other one is 34, and the third party, let's say, 33. So young adults in their 30s are expected to make better decisions. A lot of things are not new to them anymore because they had their first experiences. And let me switch with this sentence to relationship and couples therapy. This is how it's known, and there are several books about the topic. But let me tell you that it's very different. Even though we talk about dating relationships, and several stars get a divorce and then they start dating again, and 20-year-olds can go on dating, can go on a date and start dating, but it's very different when they are in their 30s. In order to do marriage therapy, they have to be in a committed relationship, and they have to be in a relationship that has a certain past, because a relationship therapist has to assess those situations that bring out the worst in the couple, but they want to stay together. And we have to evaluate if there's anything that would indicate that the marriage is not going to survive. And the interventions have to involve additional aspects of the relationship, such as mental illness or substance abuse. You know, a 30-year-old aggressive person who might use cocaine or alcohol can be aggressive in the relationship, but how they manage alcohol and substance abuse disorder will affect the relationship. So the relationship therapy cannot go without that assessment or without giving them a referral to a substance abuse treatment program. It came up before that we should do roundtable discussions about the issue, and I'm very much open to it. But let me tell you about myself as a professional. I'm not really confined to any major specialization because I have 3. And the reason why I have 3 is because I got my training on 2 different continents. One of them was Europe, the other one was the United States of America. And I had my first degree in psychology with emphasis on clinical psychology, the second degree in marriage, family, child therapy, and then industrial organizational psychology. The common area in these specializations is that I always work the most with this age group, 18 to 25 or 14 to 25. So I have a lot of experiences with them. What I did not do that much is getting involved in their vocational choice. So right now, my research area is organizational climate, and I'm preparing a handbook for managers and organizational leaders how to integrate millennials and Generation Z employees, those who are just leaving high school these days, how to integrate them into the workforce so that they could attain the organizational goals. Although this sounds different, it's still their lives. It's the life of a 19-year-old who is entering employment for the first time, who's starting dating, maybe move out of the parents' house. You know, these are the issues that were the closest to me. And throughout my career, I worked with the psychologically healthy and the mentally ill. So I had that in my background. I also had to do military psychology. I had to enlist 6,000 18-year-olds in the Hungarian military when it was under communist control, and I was not allowed to leave the country despite my only ancestor, my father, lived in the United States. And this means 6,000 clinical interviews, aptitude test evaluations, and most of them were psychologically healthy. So I have that in my background. I worked in at least one juvenile prison, juvenile detention. I participated in youth programs, and I had plenty of group home experiences. Foster care kids came to me for treatment, and I had, of course, adult clients as well. And I did some relationship counseling, but in my case, somebody had a mental illness diagnosis. In any event, I'm going to continue with some other topics. What I would like to talk about in the next video is suicidality in Shakespeare's Hamlet and Hamlet's soliloquy. But we will continue with relationship issues when we have a roundtable discussion about partner relationships for young adults. Thank you very much, and see you soon.